Let's get more on the situation facing Gaza's doctors now. From Tromso in Norway is Dr. Mads Gilbert. He's a professor of emergency medicine at the University of Tromso. Dr. Gilbert has been working with and training junior doctors in Gaza for the past 20 years. Really good to have you with us, Doctor. Let's start with Dr. Abu Safiyah, because you knew the man and you were deeply shocked when he was arrested in December. And we recently saw images of him looking very weak and emaciated. Tell us what your response is to his apparent release on Saturday.
Well, first of all, I think I am with millions of healthcare workers around the world who feel strongly and very, very relieved that Dr. Hussam Abu Safiyah finally will be released, because he has become a very important symbol of the heroism of the healthcare workers in Gaza. Because they have been detaining not only Dr. Safiyah, they have been detaining hundreds of others, and they have killed more than 1,000 healthcare workers in Gaza through the last 15 months. So Dr. Hussam Abu Safiyah is a shining symbol of the heroism and the moral standing of the healthcare workers in Palestine, who have been standing by their people throughout this massacre and all these horror times when the attacks on hospital, on ambulances and primary healthcare centers has been such an integrated part of the Israeli occupation forces' tactics against the Palestinian people and their resistance. So for me and for all the others who have been campaigning to have Dr. Abu Safiyah released, it is, of course, a very good day to see him. Second, it shows that the Israeli authorities and the Israeli occupation army is violating all international rules on how to treat a prisoner. You can see from the footage that he has lost weight. He has probably been tortured, and the interview itself is a very degrading way of exposing a human being. He is handcuffed, he is being abused by his guards, and is being abused by the so-called interviewer. So they are breaking the rules of how to treat prisoners or war prisoners. And thirdly, I think the coldness and the arrogance and the inhumanity that these persons, these Israeli guards and this civilian, whoever he is, who interview him, the coldness and the lack of humanity that they show is making us all freeze, because we do not want a world where humans are treating other humans in this way. And I think the stark contrast to what we just saw with the exchange of the four killed hostages, treated with dignified respect and order by the Palestinians, is a contrast between two worldviews where the core problem is actually this deep-rooted racism that is so pointed in the way that Israel and the United States and the Western governments are treating the Palestinian people. This is colonial racism at its worst. And I think this expose of Dr. Hussam Abu Safiyah, my colleague, my respected colleague, my role model, shows everything that the world is waking up to now, namely to understand that we are still in the midst of brutal colonial politics exposed by Israel and the United States. And this one video clip is showing us everything. We don't want a world where human value is degraded. We don't want a world where human value is different for white and black and melanin-rich people. We want justice for everyone. And Dr. Hussam Abu Safiyah is going to be a shining symbol in history of the bravery of the Palestinian people, and not at least the bravery and the steadfastness of the healthcare workers in Gaza and in the West Bank.
And Doctor, can I ask you just one quick question? Because we spoke to you quite regularly over the course of Israel's 15-month attack on Gaza, in which its healthcare system was decimated. And even now, we've had reports that Israeli forces are blocking the entry of much needed aid, including the delivery of materials to actually rebuild the enclave. What's your hope for Gaza's healthcare system? Because in your view, I guess it must be almost impossible to rebuild healthcare facilities there at a quick enough rate in order to treat people in Gaza.
Well, first of all, I think I'd like to just make a comment to what Professor Sveiri noted, that the Israelis are not upholding the agreement for the ceasefire. They do not allow a sufficient number of patients needing treatment abroad to exit from Rafah. The number should be at least 50 per day. It's much lower. There are 12,000 patients waiting to go outside Gaza for needed treatment. They do not allow the tents and the mobile homes in. You can never trust the Israelis. They are lying and they are cheating. And this is nothing new. I mean, I've been in Gaza during ceasefire times, during previous attacks, and they violate the ceasefire order always. So you can never trust them. About the rebuilding of healthcare in Gaza, one thing that the world is not exposed to is the phenomenous capacity of the Palestinian people to rebuild. If you look at the attack in 2014 or 2021, you know, only weeks after the new buildings are erected. And what has not been reported is the fact that the Palestinian Minister of Health in Gaza, under the leadership of Dr. Youssef Aburish and his team, they have reopened a number of hospitals that the Israelis had closed down and partially destroyed, like the Nasser Hospital, in fact, like Shifa Hospital, the Eye Hospital. Kamal Adwan was rebuilt before it was destroyed again. So I am very optimistic that if given the right resources, the Palestinian people will rebuild, reopen, and restore the healthcare system very swiftly. The problem is the lack of resources, the lack of money, the lack of building material, and the lack of safety and security. So I'm sure, and we are thousands and thousands of healthcare workers in this world who wants to stand in solidarity and support the rebuilding of the Palestinian healthcare system under Palestinian leadership. And we have to be loyal to that and not make Gaza an other donor-dependent, NGO-driven country. It should be Palestinian, and they are totally capable of rebuilding and restoring, as they have already done with many functions.
Dr. Mads Gilbert, thank you very much again for joining us on the program. We appreciate it.